You know, it seems like we learn something new every day about the unrecognized struggles families face when it comes to the health of their child.
And the more we talk about these seemingly unheard conditions, the more likely there will be awareness, understanding, and more importantly, treatment and cures.
Now today we're going to focus on a condition called Angelman Syndrome. Angelman Syndrome is a rare neurogenetic disease that occurs in 1 out of every 15,000 births. It's often identified through developmental delays, including seizures, absent speech, wobbly walking, and balance difficulties. The syndrome is often misdiagnosed as cerebral palsy or autism, but a key characteristic of the disease is, despite the difficulties, Angelman Syndrome patients display an overall happiness. So, what would you do if your son was born with a serious disorder and there was no cure? Terry Jo Bichelle knew what she had to do. Find one.
Time to wake up.
It's the same every morning. Terry Jo Bichelle lifts the curtains in her 16-year-old son's room. It's a daily reminder of her mission to erase the shadows in Louie's mind.
Louis can't talk, but he can pretty much tell you what he's thinking all the time.
The youngest child, Louis, was 14 months old when his parents discovered why he wasn't developing normally. Louis has a rare genetic disease called Angelman Syndrome, and his mom immediately started grasping for a cure.
At that point, I started thinking that there couldn't be anybody more motivated to find something that would work than me.
So at 50, Terry Jo quit the job she loved as a midwife and enrolled in a doctoral program in neuroscience.
Good morning.
She's definitely a mentor to me, and it's inspiring to watch her work.
Terry Jo's tireless research is already paying off. Her findings are being used to test a drug that cures Angelman syndrome in mice.
Can you imagine reversing an intellectual disability? I mean, 5 years ago, people thought I was crazy. And now it's a reality. We're this close. Come on, sweetie. Let's go sit down.
Now, human trials on this drug could start within a year. The drug compound has reversed Angelman syndrome in adult mice. And even though Louis will likely be too old to actually participate in the human trial, Terry Jo says if this drug is approved, Louis is going to be the first in line to get it.
Oh yeah, I'm sure he is. Well, this next condition is one many of us have heard of, but you may not have realized just how serious a problem it could actually be. I'm talking about scoliosis, and if left untreated, it can be fatal to some children. For years, the treatment for scoliosis meant a childhood of surgery after surgery to straighten the spine, and the complications that came with it. But that is changing with a newly approved procedure, giving children like this next little boy a brighter future because of it.
Kind of nervous today?
Yeah.
Because it's our first time?
Yep.
And even for a big guy like Braden,
How old are you, Braden?
8, turning 9.
not knowing what to expect can be the scary part. For a mom, the scary part was seeing this, an x-ray that showed Braden had scoliosis and knowing what that would bring.
He was going to have to get cut open in the same spot every 6 months. And that would go on for years.
Yeah.
For years, that was the standard treatment. Conventional growing rods were used to straighten the spine, but it came with complications.
It's a given. In certain series, over 100% complication rates throughout the course of somebody's treatment, so it's not a question of will you get a complication, it's kind of when will you get one.
Which is why Braden and his family opted for a new procedure. Surgeons implant growing rods in Braden's back, but these are equipped with magnets that allow his spine to be straightened without going back into surgery every 6 months. Braden is one of the first kids in the state to have this.
Instead of having to go to the operating room, we're able to just do this in the clinic, so there's no repetitive incisions, there's no repetitive anesthetics.
Doing okay?
Instead, once every 3 to 6 months, the magnets are adjusted to straighten Braden's spine.
You ready? Okay.
But remember, this is just the first time having this done.
Mom's here.
And the unknown can certainly be a little scary, but once finished, it will let a little boy be a little boy.
He doesn't have to be in the hospital, he can be out riding his bike, he can be a normal kid.
And it is nothing, a little medicine from your mom can't make a whole lot better.
It's nice to have my boy back. Something new, not just new for you, but something new.
Good for him.
You know, I didn't realize it could be fatal.
Yeah, and it affects 5 to 7 million people.
Wow.
Well, here to tell us what else we may not know about the condition is orthopedic surgeon Dr. Scott McGovern, who's with Peninsula Orthopedic Associates. Thank you so much for coming
Hey,
in.
thanks for having me.
All right, let me ask you a very simple question. What is scoliosis?
Scoliosis is a disorder of the spine that affects the spine in a sideways curvature. It can be S-shaped or C-shaped.
And we have some pictures here that kind of show that. Tell us about it.
Yes, so these show a diagram of the spine or the backbone, and they show the curvature that occurs in different areas of the spine, and this suggests the different severities that can happen.
Wow.
And you mentioned that there are varying degrees of, I guess, severity with
There are.
scoliosis?
There's different variations, and the variations may be non-structural, in which the structure of the spine is normal, but the curve occurs for other reasons. In that case, the doctor will try to find the cause and correct it. These are temporary. The other kind is structural, and the curve is fixed. These can occur for neuromuscular disease, injury, infection, birth defects, and other causes.
Well, we just saw Braden. Braden's 9, sorry. Braden's 9. When do you start, how old do you usually start seeing this?
Well, scoliosis can affect people of all ages. The most common type is idiopathic scoliosis, and that occurs in the 10 to 12-year-old age range into early adolescence. See, this is the time when children are in their rapid growth phase,
Right.
and that's when the curvature tends to present itself.
Okay.
And it's something that can run in the family, isn't it?
Yes, it can. Scoliosis can run in families. If a child has a brother, sister, or a parent with scoliosis, they should be followed regularly by their primary care doc to follow the scoliosis, and they may be at risk for it. But most of the time, it occurs for various reasons, and we don't always know the cause.
Do you have a specific way to diagnose scoliosis?
Yes, the doctor will do a medical history and look at the family history. We perform a physical exam, and we'll usually obtain some sort of testing to look at this. X-rays are a very common test, for example, where they can tell us the measurement of the curve and quantify actually the degree of the curvature to determine how severe it might be.
Now, we just saw how they are treating it with magnets, which is fascinating, but there are other ways to treat it?
Sure, scoliosis treatment's varied. It depends upon the type and severity of the scoliosis. We look at how severe the curve is, and in particular, how long that person has left in their growth, how much change might occur because of their scoliosis, and we decide based on that. Sometimes it's observation, sometimes there's bracing, sometimes surgery. Other treatments may help too.
So along with surgery, exercise?
Sure, there's a lot of options. Exercise, chiropractic treatment, electrical stimulation, keeping the muscles in their tip-top shape. Even a healthy diet and nutritional supplements can help.
Really? All right.
How about that? Orthopedic surgeon Dr. Scott McGovern, thank you so much.
Thank you very much for having
Very
me.
important information.
And if you would like to learn more about scoliosis or its treatments, visit WBOZ.com and click on our picture at the top of the page. Well, something else that can harm our health, or so we thought, screen time. Up next, find out why health experts are now rethinking their guidelines for kids and how much time they spend in front of the tube.
Our kids are like sponges, soaking up anything and everything. You're going to find out how these sticky mittens are throwing into question just how soon our little ones are ready to learn. Delmarva Live, we'll be right back.